talking about hope. I love that
Mhm.
because without hope, obviously you're hopeless. And what are
Yeah.
some other things that you found super effective in?
Like the visual system and the vestibular system. The PTSD that comes from these traumas is a whole nother ballgame, right? And I've experienced that myself. So
Mm.
calming the nervous system and giving people, like I give all my patients these brain stickers
Mhm.
and I tell them to like put them on their door, put them on the computer, put them in the car, put it on the doorknob. And like whenever you see this sticker, take a really deep breath, like I'm safe in this moment, or like I'm healing, or just trying to do those constant positive affirmations of like,
Mary, welcome to the podcast. Thanks for coming on.
thank you for having me.
Awesome to have you here. So let's just dive into your background story. I knew that something happened to your father. Can you go in and explain to that?
Yeah, so my name's Dr. Mary Pavlantos, and I'm a doctor of physical therapy. I'm also a certified brain injury specialist,
Hmm.
and I'm north of Denver in Colorado. I got into brain injuries because my dad was T-boned and rolled 4 times when I was in high school and got a really bad TBI, and we lost like his business and our house and everything. And we didn't. He broke his neck, like his broken bones healed, but we didn't know what was wrong with dad because like his Glasgow coma was okay, his MRI in the emergency room was okay. And then like he just scrambled because he was the provider. And my mom took care of us and she's a jeweler, but like she couldn't run his business, right? And he was like the bread and butter of the business. It was a restaurant business that was like family owned, and we had like 7 businesses, and so it was like it was his thing for like 30 years. So, but he couldn't do it anymore, so he tried working different jobs because he was trying to provide to the family. And then he ended up selling cars and he slipped and fell and hit his head on like ice working one day.
Hmm.
And this was like 2 or 3 years later. And then that showed his old diffuse axonal injury from his car accident. And then it kind of brought to light. And at that point, I was in college, but it just kind of brought to light like what happened. And they're like, he has this old brain injury and this old scar tissue. And that's when like it opened Pandora's box to be like, oh, dad has a TBI.
Hmm.
What does that mean? I actually have one of the first books that was like living with TBI
Hmm.
that like we used for our family. That this was just like one of the first things we just started reading, going like, oh my gosh, everything's making more sense. But like he was so bad, he couldn't get dressed, like he couldn't process like how to get dressed. He could walk and talk, but
Hmm.
he had no memory of anybody except for our family. His executive functioning and his memory and his headaches and his decision making, like it was all very affected, but he didn't have like a lot of motor loss. He did end up having like seizures and had to like get on seizure medication and stuff.
Hmm.
But at the time, well, like we had lost everything, and I was like, oh no, how am I going to go to college? So I
Hmm.
played basketball. So I made this really fancy VHS tape and I sent it to a bunch of colleges because I lived in New Mexico and I wanted to go to California. And so I got in and I played like D3 college basketball.
Wow.
But like my first semester, I blew my knee out. Well,
Mm.
then I got into like doing physical therapy and OPTs help people with like knee injuries. OPTs help people get back people like after injury. OPTs help people with brain injuries. So I was like, okay, this is what I need to do. So I finished my undergrad at Whittier in California, and then I moved to Philadelphia where I did my graduate work at Thomas Jefferson. And I graduated in 2009 and just kind of have dedicated my career to helping people with the invisible injury. And I
Mm.
started out working in like rehab, like Craig Hospital, and like really intensive, like comatose, also with spinal cord injury with like people in sip and puff chairs. And like it was very, very rewarding and challenging. But kind of as time has unfolded, I've gotten into more specifically car accidents with people that look okay, but they're not okay. And
Mhm.
they have, a brain injury and like multiple bodily injuries going on. And it's just like they're trying to fight for their jobs, their houses, just one day at a time. So, but I'm a vestibular therapist, so I retrain like the eye movements and the balance system and the coordination. But I also do like the orthopedic musculoskeletal stuff. So, like if people have a disc or a whiplash injury, back injury, some people have like, I had one girl and someone ran an intersection, and when she honked the horn, it like shattered her whole arm.
Mm.
And so not only did she have like this TBI and this whiplash, we had this like hand we had to bring back to life. So, so a lot of it's just like you say in your book, like use the brain to heal the brain. That's been like my motto for so long, and I have all these things in my office hanging up. But it's just so much of it is like giving people hope and knowing that there's like massive neuroplasticity and billions of neurons to retrain pathways. And I've had people come. I had one lady, she came 9 years after being in a coma. She was in a coma for 3 months, and she pretty much got back, but she couldn't use her hand and her leg very well. Like it was very discoordinated. And I do like neurologic dry needling. So I don't know if you tried that at all in your rehab, but I do like dry needling to wake up the brain muscle connection to like reboot the system.
Mm.
And in like 4 sessions, I got her like full hand control, and she could like brush her teeth better and type. And so it was just like she needed that reboot because after a lot of like acute rehab, you're just trying to learn sometimes like how to walk again, how to talk again, how to feed yourself. But
Mhm.
then people are like, oh, this is as good as I can get. And I'm like, no one could ever come to me and be like, this is as good as it's going to get. Like, we got to at least try.
Mhm.
Like I've had a few people like that it was just like we tried and we got a little bit back, but like it's just like just keep trying, and then people adapt really well too. So that's a lot of talking.
No, I love it. Thank you first of all for being so open to share your story and kind of what motivated you to get into what you do, and then talking about hope. I love that
Mhm.
because without hope, obviously you're hopeless. And
Right, right, right.
what do you have when you're hopeless? You don't have anything. So there has to be a pathway for hope, and
Hmm.
one of the most important things we do. I'd love to know about like your tools. You mentioned dry needling, and what are
Yeah.
some other things that you found super effective in your
Yeah. So when it comes to like the visual system, I work a lot with neuro-optometrists. If someone has like double vision, blurry vision, like it's very important that they get the right glasses if they need that. But
Mhm.
that could change in 3 to 4 months as the brain's healing. But if people don't get the corrective lenses, I tell people it's like if you do this all day, your arm's not going to work by the end of the day.
Yeah.
But like some of my patients have resting nystagmus and they're just trying to work on the computer and they're just
Mhm.
zapped.
Yeah.
So, the eyes dry out. You got to use like moistening eye drops, but getting the eyes checked, making sure they have glasses. And then I retrain like the visual system, and the vestibular system. So the way I kind of approach it and why my business is called like Roots Physical Therapy and my logo has like a tree with a person in it. Because I get a lot of people and they're like, well, I went to concussion rehab and I went here and I went here and I went all the way everywhere. I even have people come from out of state and they're like, they told me this is as good as I'm going to get. And what I feel like is lagging is the PTSD that comes from these traumas is a whole nother ball game, right? And I've experienced that myself. So
Mm.
calming the nervous system and giving people like I give all my patients these brain stickers
Mhm.
and I tell them to like put them on their door, put them on the computer, put them in the car, put it on the doorknob. And like whenever you see this sticker, take a really deep breath, like I'm safe in this moment, or like I'm healing, or just trying to do those constant positive affirmations of like, because they've done research on this lowering cortisol and everything. So calming the nervous system, I got to get people's pain down. And if they're in pain, they're not sleeping at night. And if you're not sleeping at night, your brain's not going to get better. Although we don't want people sleeping all the time. That's the old school approach.
Right, right,
But
right.
like you have to sleep at night. Like we got to sleep at night. You got to
Yeah.
plug in the battery, and there's too many apps running. So I use the phone battery and the apps, and people totally understand that. Um, so, calming the nervous system, then I like ground the balance system and like try to get people standing on the ground with their eyes closed. And I have like a progression of balance exercises I do to like make people feel like they're a tree with roots.
Hmm.
Because if they're grounded to the earth,
Hmm.
then like when a hurricane comes, they're not going to blow over. But at least that's like one system. Usually people have like a labyrinthine injury to their eighth cranial nerve, and then you have that with the cerebellum and the neck, and then there's cervicogenic component. So like trying to integrate all of it, because there's a lot of like neuro-optometrists that do vision therapy, which is great, but it's kind of overtaxing to the eyes if
Hmm.
we're not integrating all the other systems, right?
Yeah.
So I think like what makes me different is just, two or three exercises for this isn't working. I mean, the amount of brain systems that don't work, right, takes a team. I mean, I don't do, the cognitive therapy with like the executive functioning and the memory. I work with a team for that. There's the trauma therapist working on the emotional part, which
Yeah.
also becomes a huge part of my job, is because their emotions are off because of the life change. So trying to calm people and give them hope. I do like use faith a lot. Like I ask people if they have a higher power,
Hmm.
what they call it, and if they pray, or like what is your belief system, because I will absolutely use that, because that's like an energy force that helps people heal. And I do see people heal much faster with more positive outlook that have a higher power than people that just don't have that at all. They do get better, but it's just very science based, right?
Yeah.
Um so that's kind of the tools I do. Like I have all these tools like Graston, like muscle scraping, for like myofascial release.
Hmm.
So I do like dry needling to get the tight muscles loose, or for neurological reset. Like I do a lot of needling for spasticity in spinal cord patients. So
Hmm.
like people that have spasticity or TBI or really any neurologic condition. But like sometimes baclofen and the muscle relaxers make people's brains tired and they already have brain fog. And so the medication can help, but then there's like sometimes the side effects. So the dry needling really helps. I do cupping, and then of course I like give people like exercise program and stuff like that.
Yeah.
I give all my patients like my little brain. I didn't get to the cool book like you did, so I have my little brain injury recovery guide. And like it's really big font because everybody has vision issues, so they can like
Yeah.
understand it and read it. But I just give that out for free all the time. And then another thing that's like super helpful, especially if patients are in a legal case, I have everybody keep a calendar
Oh, interesting.
of their symptoms, like because the amount of migraine management, and it takes like very good doctor to be able to help figure out the migraines, because
Mhm.
there's like 6 to 8 different kinds of headaches that can come with head trauma. And sometimes that is like ruling a patient's life. If we can't get the headaches, is it coming from the neck? Is it a migraine? Is it fatigue? Is it the vision? Like, you know what I mean? So I have people keep their calendar. It's like it should get better, 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 better. But sometimes you don't see that change until 3 months, sometimes a year, sometimes 3 years. And this is what the hardest part of this injury is the time it takes to heal.
Yeah.
So, as you know.
And I that brings to like a question that I often have. Of course, I'm so blessed. I'm so blessed to work with amazing people around the world that inspire me every day. But it does get challenging, as you mentioned. How do you kind of push through that challenging aspect of helping others? Because, I personally want their recovery
Mhm.
sometimes more than they do. So how do you kind of work through that in your mind?
Well, part of that is kind of being an empath. Like, I don't know if some people realize they're empaths. Like, I always thought I was just an empathetic person. My dad
I
got
know
in an
I
accident.
am. I'm big
Yeah.
time empath.
Yeah. And I so like, oh, here, so I'll get to, so my dad had an accident. So I want to help people that had head injuries from a car accident because I really care. But then I got my own brain injury from
Mm,
COVID, and I got COVID encephalomyalgia, and it like
mm.
attacked my brain tissue. And my
Yikes.
brain was so swollen, like my eyeballs were going to come out of my head, and there was like ringing in my ears,
Oh,
and like my lungs shut down. This is like the Delta September 21 strand. And, I have like Christian healthcare ministries, and I don't want to go be medical bankrupt or like on a ventilator. I don't know if that's a better option. So
right.
I like fought the good fight, right? At like every supplement or medication I could take, and I just like couldn't eat, and I felt like I was dying, and I just heard a voice say like, you have kids, you got to fight, you got to give it, you got to go. And so I just started like walking to the front door, come back, like go to the bathroom, come back, right? And so, that was like, there'll be 4 years in September, but it gave me long haulers, which affected mainly like temperature regulation with dysautonomia and
Mm.
my frontal lobe. So like a lot of executive functioning, memory, brain fog, that kind of stuff. So it's just like I had some bit of empathy to like how my patients felt because only one part of my brain was affected. But
Hmm.
then it kind of opened this like spiritual awakening for me to realize like, oh, I really am sent on this earth to help heal people. And like I feel people's stuff, like you're saying. And so like I've had to figure out there's lots of books on like different types of empaths and tools you can use. So I have all kinds of crystals, and I like touch plants, and I exercise, and I do deep breathing, and I have all these different tools
Yeah.
to help me release, because no matter what tool I've tried to learn from other healers to
Mhm.
shield and protect, the moment my hands go on my patient, I take it from them. So
Yes.
like I also do like spiritual work and help heal clear people's like chakras and their stuck energy and stuff.
Yeah.
So that all came new from my transformation, and I kind of added that into my practice to help people heal, because a lot of times people have an accident or have whatever, but there's like with the PTSD, there's like all kinds of old traumas that come up, and then the body's sick, like the book, The Body Keeps the Score, and
Hmm.
like they've got every medical test done in the world, and they can't figure out what's wrong, and it's just because like there's energy stuck in these like massive points of neurons in the body, like
Yeah.
someone has anxiety in their chest and it's clogged in their heart space. So
Yeah.
just trying to like pull it all together, like mind, body, soul kind of thing.
Mhm.
So and some with some of my patients, like I go there and I go there through prayer, and with some people like we just talk about it. And so but
Yeah.
it does like help people heal to know like that they can just let that go, be part of their past, and
Hmm.
it is part of why they are who they are today, and it should empower them. And you just see so many people go through like crazy traumas like yourself that did something good with it, right? And unfortunately, if people don't go that direction, people turn to drugs and alcohol
Yeah.
and the dark side. And I know you've posted a lot about this on your Instagram, and like I kind of went down that path myself, and then realized like what was happening, like I'm band-aiding, I'm not fixing, right? So trying to like deal with the emotions, get the right therapies, do
Hmm.
the things to heal instead of just band-aid.
Yeah, it really takes a village
Totally.
in this. There's no doubt about that. And with COVID-19, I think a lot of people don't understand that that is a brain injury. It is a chemical or, viral brain injury. Um, like how do you educate people? Have you helped people with long-term COVID as well?
Hmm.
Yeah.
Yeah, it's coming to me more, but it usually comes because like someone comes in and they have like a back injury. And then I don't know, we just get talking about things. But I think a lot of people have this and they just don't know why they're tired all the time, or they just viruses have attacked the nervous system for like all history of humanity, right?
Yeah.
Like we know that there's been West Nile, we know that they're like Guillain-Barré, we know that viruses attack the nervous system, but I
Mhm.
think so many people didn't know that, experienced it, and all think about it a lot as like a respiratory thing. But the
Mm.
fact that you couldn't smell is your cranial nerve to your nose to your brain. So obviously, COVID affected anybody's brain that couldn't smell. So like I still can't smell. I mean, I smell maybe 50%. And I've tried to do smell retraining and smell everything I can all the time. And I don't know
Yeah.
how else to bring it back.
Yeah.
But I mean, I take all kinds of supplements, work with a naturopath. There's like some research showing like low dose naltrexate can help. So like there's just like different things to try and they're researching.
Mhm.
But I mean, a lot of people, we lost a lot of people fought for their life, and then some people got that really, really bad fatigue. Well, that's because their brain was affected. So, and then people had a TBI from a trauma and then also got COVID. So like another punch and a punch. But I
Yeah.
just like I've seen enough humans, and like thousands of humans probably at this point in my 16 years, and just people persevere and they keep going and they keep fighting the good fight.
I
And
love
so
I love
it
that
just makes
that
it
thought
better.
process, fighting the good fight, and it really is like it's such a battle. Because I remember my impulsiveness when I had my brain injury. I was like a little child in my voice that couldn't stop from saying crazy things and doing wild, erratic things, and um, my freedom was when I learned that, unbeknownst to doctors and unbeknownst to um, everything that I was told at that time, that the brain could get better and could get healed. And that was just like liberation for me, that holy crap, like things can change. And then I learned that a brain injury actually makes the brain more plastic and more malleable than it was before, which is crazy because, the brain is a mystery that we'll never understand. And then you add on top of a brain injury, it becomes
Mhm.
even more mysterious. So I think that also gave me hope that like, oh, like it's like scrambled eggs in there now, but I can get it all back together. Like Humpty Dumpty, I say, the Humpty Dumpty story.
Totally. And unfortunately, all the nursery rhymes, because I have kids, have to do with head trauma. You're
Yeah.
like rockabye baby, and like when he falls and then he doesn't wake up. I'm like,
Right,
oh,
right, right.
heck,
Yeah.
like who made all these nursery rhymes? But I also have seen, now that I experienced it and I never put this together, that there's this like I just have seen it in so many people, this spiritual transformation or transformation of self or what you're supposed to be doing. Here's a good example. I have a girl that was an Air Force medic. She's
Hmm.
in the Air Force because she wanted to help people, and she was going down the Air Force medic. Like that's really intense, right? And then she got rear-ended 75 miles an hour and like such a bad whiplash. She like hit her head on the steering wheel, on the bars behind her, and then on the steering wheel again, and also got like a spinal cord bruise on top of her TBI.
Hmm.
And it's like completely transformed her because now she's still healing, but she realizes like maybe that was a little too intense of a career for her, and she can't go back to it because of her head injury. But then she's like, wants to help people like in a different direction. And it's like, so, even like the path that my dad, how it took my dad on his path. And so I think it just changes you or your trajectory and like to where you're supposed to be. You know what I mean?
Yeah.
So,
And recently I did a 3-day challenge. The idea of helping people get back to their profession or back to business. And one particular thing that somebody said kind of um, I wanted to talk about it because it's on my mind. She said, you know, Brody, you had support. You had your mom's and
mhm,
dad's
mhm.
support, like of
Yep.
being back.
Yep.
But what do I do if I feel isolated? And I'm like, there are online communities, but that doesn't always cut it for most people,
Right.
you know?
I mean, that's like it's funny that you say that because I was thinking about that at the tail end of what I was saying, but like the support system is a game changer, right? So if you have a spouse who's empathetic and supportive and like is there for you, or financial resources, like
Hmm.
it all changes the picture. Like I have people rear-ended by a drunk driver that didn't have car insurance, and luckily they had their own car insurance. That's why we carry underinsured motorists. Or like slip and fell on ice just going to the grocery store one day, and they're like a single person that's 68 years old. So like having the support system, but what I've found the most, unfortunately, like hurt people, and the people like that come together for you in your pain and suffering are your real friends, and the rest of people like they, I don't know, it's like they throw stones and they're not as supportive. And I mean the amount of times I've heard this story and
Yeah.
I'm like, well, they're not really your friends.
Hmm.
But there are like online support groups. I always tell people like 988, thank God, like because how many lives had to get taken from suicide, like that you can call that number anytime and someone will be there for you if you're just
Yeah.
not in a good headspace. But another thing is just like health insurance, and like a lot of providers like myself, excuse me, this is allergies time
Hmm.
and it's snowing in April.
Yeah. Welcome to
Um,
Colorado.
yeah,
Rad.
exactly. So I don't take health insurance because I take Medicare, but I because like I spend quality time and I just have to like be able to spend an hour at least with my patients to help them get better.
Hmm.
And unfortunately, with a lot of commercial insurance plans, it's hard for a lot of places to take it. And so if you specialize, like I go to trial in front of a jury, like I put a lot of energy and time into my reports and talking to doctors and attorneys and like helping my patients get better. But like, yeah, the resource thing is a problem too. So I mean, you just kind of, everybody has a different situation and a different outlook and different social, different living situation. I mean, so it's just, yeah, like having the support system. I do a lot of family meetings to try to explain to like a spouse and children how your parent is being affected and how to best help them, because they're like, well, mom looks normal. Why? She's not any fun anymore,
Right.
right?
Yeah,
And
yeah.
then like that, just so you know, there's an 80% divorce rate with this diagnosis. So you got to really like calm in, and I need you to be really strong for your partner here.
Yeah,
And
yeah.
I need you to realize like these are the areas that are affected. And I pull out my brain model and I show a video, and like this is what this person's experiencing.
Hmm.
Could you imagine being like 6 drinks in all the time without the
Oh,
fun part?
oh,
Because like the balance system and the memory and the decision
yeah,
making and the
yeah.
vision and like the dizziness, right? Like that's
But
how a
in an
lot of
unfun way, like in a very
no,
unfun.
like yeah, I say 6 drinks in, 8 drinks in, or more without the fun part. Like that's how they feel, but they don't, they look fine. And
Yeah.
then my daughter, unfortunately, she wrote this little book, My Invisible Injury, the story of
Yeah.
concussion. Because my poor little daughter, and this is just like published on Shutterfly by mom because I couldn't find a publisher. So if there's any publishers listening out there, it's the only book written by a kid about concussions.
Wow. That's
Everything else is written by
incredible.
an adult.
That's
Um,
amazing.
yeah, but she got hit her head on a bar at school, and then my son threw a glass vase that shattered on her head, like within 2 months after. And so I really like working with kids because they really hide. They also heal very quickly, but
Mhm.
it's like the attention at school, the overstimulation, it really affected her reading and her processing. And
Mhm.
if I wasn't like brain doc mom, nobody would have known, right?
Yeah,
So I
yeah,
had to
yeah.
really advocate for her to get better. And her first concussion was in second grade. She's in seventh grade and she's just almost out of her IEP. Like that's how long it took her. to recover. And then, she like flipped out of a hammock and hit her head and couldn't walk for an hour. Like it's just that statistic of like, if you get one, well, I guess it depends on where you're looking, but like you're 3 times as likely to get another at 8,
Right. Yeah.
15 or whatever. I don't know. It's probably all different depending on where you look, but
Yeah,
so like working with kids is like a big deal
it is.
because it just affects so many people. And then she's so cute. She like dedicated this book to my grandmother. And unfortunately, elderly is a whole nother population because it's one of the number one causes of death in the
Oh,
elderly.
hmm.
And my poor grandmother was shopping at Macy's and fell down an escalator and got a TBI, and that
Oh man.
took her life. So it's just like I've had this family of like TBI stuff, and it's not necessarily that I'm just like aware, it's just like happened, right?
Yeah.
But it's I think why it happens to me is to like help others, right?
Yeah.
And so it's just also like whatever's in the plan's in the plan.
Well, I guess it kind of alludes to the facts of how common this really is.
Sure, right.
But also, of course, there's like a story kind of going on with your family in some ways, with all of that.
Mm-hmm.
How a few last couple questions. How important is educating your patients, and how do you go about educating people that really it doesn't quite seem to stick, at least at first, if that makes sense.
Well, there's a pretty good YouTube video that shows, I think if you just YouTube like concussion and I can send you the link. But it shows like that the brain is jello in the skull and how it like when it vibrates, like how there's that neuronal
Yeah,
damage.
that.
So sometimes like you need that visual.
Hmm.
um and that's another thing with like CTE and sports, and that's a whole other conversation.
Hmm.
But like I show people that video seems to help, but then there's also narcissistic humans that are always going to be right and always put someone down, and they're not going to be supportive, and like you're not going to be able to help. And I believe that's like a trauma response, but like you're not going to be able to help educate everybody because it's just not in their innate being to have empathy or to be there or try to understand, because
Right.
it's just about them.
Hmm.
So
Yeah.
unfortunately just I try my best. And then another good thing I tell people is like, well, since you have a frontal lobe injury, your BS filter's gone. And so you're going to just, right? You're just going to say it as it is. And
Yeah.
it's usually the truth. And people
Mhm.
don't like to hear the truth. And you're going to lose people over this.
Oh
But
yeah.
it's because you told the truth and there's only one truth, right? And so, and I don't know that that's necessarily a bad thing. It's when the frontals like get angry and we end up punching holes or in jail or whatever because of the
Yeah.
frontals. So,
Yeah.
when that emotional and that anger is like out of control. And I talk to patients about how to try to diffuse that and
Yeah.
use like tapping and like try to walk away and like
Mhm.
realize it's happening. I also tell people to come up with like a code word for their family if they
Okay.
know that they're getting like agitated, and I'm like,
Yeah.
say cupcake or something funny, and like diffuse that part of
Ah,
the brain's like, ah,
cupcake, cupcake.
cupcake. Well, I told that to one patient, and she's like, yeah, I just have the bit. And I told her you got to use like try like cupcake or a code word, and she pulls her sleeve up and she's got a big old cupcake tattoo on her arm. And I'm like, well, that's not a coincidence, I don't think.
I guess not. That's so
So,
cool. Thank you
it's
for
just,
sharing. Yeah.
yeah, for sure. It's just like so complicated.
Yeah.
And then also, I feel like so many people get steered in the wrong direction, and like they get medications that they don't need or are inappropriate from certain providers that don't know how to manage TBI. And then like that makes things more complicated because we're not treating things right. So there's only like a small handful of doctors I work with in Colorado
Hmm.
because like it's very hard, and I feel like people are not on the right medication or they're not be given the right advice. And so, everybody specializes, but like, you
Mhm.
know, not everybody does it good like any profession, I guess. But
That's true.
yeah.
And yeah, I think first of all, we'll wrap this thing up. But thank you first of all for sharing.
Thank you for having me, and
Yeah,
thank you for I was gonna say like your story. I've done this for 16 years and like your story is absolutely like inspiring and phenomenal. And I send all my patients to your Instagram because you don't see people make this success that you have made, getting a higher level education, writing a book after the type of brain injury that you had. So it shows that like you can do it.
yeah,
Like just have faith and like you can
yeah.
do it. You know what I mean? Like it's very inspiring your story and I'm so proud of you. I hope everybody in your family and your life tells you that.
Thank you.
But you should be really proud of yourself.
I truly do appreciate it, and thank you. So go reach out to her. Like, wow, like not only has she been through it, understands it experientially, and the knowledge and an incredible amount of experience as well. So how can people reach out to you as well?
So, my website, Roots Physical Therapy and Wellness, has all my contact information. My number is 720-704-740.
Okay.
One, because my brain injury, so I originally memorized it wrong, which is absolutely hilarious. And then Roots PT and Wellness Co. is my at Gmail is my yeah, is my email, and then my Instagram's Dr. Mary Pavlantos if they want to follow me on Instagram.
Fantastic.
But
And I'll put
I'm
all of
glad to help.
that in the notes descriptions, including the extra number as well.
Just make sure you put the right phone number. I had the wrong phone number on my first set of business cards, but it's okay. It all worked out. I've had my business for 3 years and it's going
Yeah.
great. And I feel like I'm still in my healing journey.
Oh yeah.
And like, I got a lot of gut issues because of my long haulers and I had to heal my gut and the
Yeah.
gut and the immune system and the brain are so connected. So I'm just learning a lot more about how dynamic it all is through my own healing journey too. So
Yeah, exactly. And that's kind of what I want to leave everybody with is it's not about perfection. It's just about like baby steps and progress in the right
hmm
direction.
hmm
Don't get discouraged. I'll leave you with the final words.
Oh, well, just thank you for having me. And I look forward to educating more and more people. Hopefully, this can be like a cool YouTube podcast that explodes and every brain injured patient or anybody with any brain, like Parkinson's, MS, like
Mhm.
anything causes brain injury. I also am like partnered with like the Rosantham Center for Domestic Violence because like people get head trauma from abuse. So like it's very big. So and there's a lot of people to help, but there's a lot of healing to be done. So
100%. Well said.
yeah.
Everybody have an awesome rest of your day.
Thank you.